Good afternoon and welcome to the April 30th Community Update. My name is Stacy Wood and I'm a Public Information Officer in the Emergency Operations Center. First, I want to recognize the people that are working to make sure that the information that we share in these updates, as we're trying to reach our Spanish-speaking and deaf and hard-of-hearing residents, are recognized. So thank you to Spanish interpreters from Sensatele Language Justice Cooperative and to the American Sign Language interpreters Ashley Kervalka and Regina Pente. This community update is available in Spanish on the Buncombe County Health and Human Services Facebook page, and that can be found on Facebook at BCHHS. Today's updates come from Dr. Jennifer Mullendor, Interim Public Health Director, Brownie Newman, Chair of the Buncombe County Board of Commissioners, Esther Mannheimer, Mayor of Asheville, Fletcher Cove, Buncombe County Public Health Preparedness Director, and Dr. William Hathaway, Chief Medical Officer for Mission Health. And today we will get started with an update from Dr. Mullendor.
Good afternoon. As of noon today, there have been 68 lab-confirmed cases of COVID-19 in Buncombe County residents. Since we last spoke, we announced an additional fatality associated with COVID-19 on Tuesday. Behind these case numbers and fatalities are mothers, fathers, brothers and sisters, husbands, wives, and friends. Every case and every death leaves a mark on our community. This is why we are here talking with you today, to express how serious COVID-19 is and how all of us can continue to do our part to slow the spread in our community. Today, we have several new and exciting developments to share with you. The first is the Buncombe County COVID-19 data dashboard. Second is the expanded list of symptoms for COVID-19. Third is the Buncombe County COVID-19 self-checker. And finally, additional information on how to access testing for COVID-19. So first, for the data dashboard that's now available on the county's COVID-19 website. This dashboard includes information on lab-confirmed cases of COVID-19 in Buncombe County residents by date that their test was collected. The demographic information that we've previously shared on cases is available as well. The dashboard also shows the number of tests for COVID-19 that have been performed on county residents and reported to Buncombe County Public Health. At this time, the testing data shown here does not include tests conducted in-house at Mission Hospital, which has been almost 300 tests to date. We are working on getting that information added to the dashboard. So when I do all the math, currently we are aware of almost 2,600 tests that have been performed on county residents. Second, I want to talk with you about the symptoms of COVID-19. If you recall, for weeks I've been mentioning fever, cough, and shortness of breath. However, earlier this week, the CDC expanded the list of symptoms of COVID-19 and recommends that individuals with the following be evaluated for testing. So we still have cough and shortness of breath or difficulty breathing. Now they also include at least 2 of the following symptoms: fever, chills, repeated shaking with chills, muscle pain, headache, sore throat, and a new loss of taste or smell. It is important that anyone with these symptoms be evaluated for COVID-19. And the next thing I want to talk to you about, the Buncombe County COVID-19 Self-Checker, is a great way to start the evaluation process. This self-checker is now available on the county website, and it's a confidential and quick system that will provide clear guidance for anyone who thinks that they may have COVID-19 and needs assistance with finding testing. It also will provide data that will help us as a county know more about what's going on in the community, how many people have symptoms, and will provide more information to help us through our phases of reopening. So here's how to use the self-checker. First, go to buncombecounty.org/COVID-19 and click on the COVID-19 Self-Checker banner button. Follow the prompts to share information about your health, any symptoms you're having, and your health history. If your results indicate that you need testing, we will connect you with testing and other support to keep you as safe as possible. If you have symptoms, we will continue to follow up with you every day for 7 to 10 days after you complete the self-checker. We want to make sure that everyone in our community is getting the care that they need. You can also use the self-checker by calling the READY team at 828-419-0095, Monday through Friday, 8 a.m. to 5:30 p.m. I encourage everyone to use the self-checker if you believe you might have COVID-19. And finally, let's talk a little bit about testing. So as I've mentioned before, we have primary care providers in the community, urgent care, clinics who have been and continue to conduct COVID-19 testing on individuals with symptoms. Testing is available to everyone, regardless of race, income, gender, ethnicity, citizenship status, or religion. If your primary care provider does not offer COVID-19 testing, there are other options in our community. Mayhex Family Health Center off Hendersonville Road, Mercy Urgent Care centers throughout the community, and Range Urgent Care have expanded testing at this time. We anticipate that additional partners will come on board as testing supplies are now more readily available and guidance for providers has changed to encourage more testing. At this time, the county does not plan to offer any drive-through testing sites, but I'll say no options are off the table as we see what continues to occur with this ever-evolving situation. We are working with additional partners to explore further testing opportunities, including getting testing out into under-resourced areas of our community through our federally qualified health centers. Information about testing locations can be accessed through the self-checker and is available at buncombeready.org. If you have private insurance, payment for your COVID-19 test and for an office visit should be covered by your insurance. If you are uninsured, the CARES Act, C-A-R-E-S, from the federal government may be used to cover the cost of clinic visits and testing for COVID-19. And some of the providers that I mentioned above offer charity care assistance or sliding scale options for payment. We encourage you to check with your provider about these details. So please continue the good work that you've all done at staying home and staying safe, keeping your physical distance, but staying engaged. Keep washing your hands, cleaning and disinfecting frequently touched surfaces. Check out the resources that I mentioned today on our website. And together we'll learn more about what's going on in the community related to COVID-19 and work to prevent further spread through Buncombe County. Thank you.
Good afternoon. I'm Brownie Newman, Chair of the Buncombe County Commission. On March 12th, Buncombe County declared a local state of emergency to prepare for the threat of COVID-19. At that time, there were just 2,200 documented cases of COVID-19 in the United States. Now, just 49 days later, there are more than 1 million documented cases and more than 60,000 people have lost their lives as a result of COVID-19. Fortunately, here in Buncombe County, the number of people who have become seriously ill as a result of COVID-19 is lower than most other metropolitan areas across North Carolina and across the country. Local residents, businesses, churches, and community organizations have been very responsive to the county's stay home, stay safe policy, which has reduced the spread of this contagious illness. Thus far, according to Mission Hospital, about 25 residents have been admitted to the hospital who were determined to be positive for COVID-19. There have never been more than 6 individuals at any one time in the hospital who were confirmed to have COVID-19, and the number of cases has usually been between 2 and 4. For this reason, Buncombe County supports Mission Hospital's plans to resume some medical procedures that had been previously placed on hold to assure adequate capacity at the hospital. We are eager to begin the process of restoring more economic and community activities as well, but we must do it in a way that continues to prioritize public safety. Governor Roy Cooper has announced plans for a reopening process for North Carolina using a phased approach and with scientific metrics that can be tracked to assure that COVID-19 remains in check. Today, I will sign a revised local emergency order that further aligns our county policy with the overall approach being taken by North Carolina. The revisions to the local order today will enable the revised number of people who may attend a community gathering from 0 to 10, consistent with the North Carolina policy and with requirements for social distancing. Governor Cooper has announced that phase 1 of reopening could occur as early as May 9th, but this is contingent on data to confirm that transmission of COVID-19 is leveling off or declining. Phase 1 will likely, based on the governor's comments, enable retail businesses to resume operations, but with limitations and safeguards. Phase 2 of reopenings could occur within 2 to 3 weeks after Phase 1, but again contingent on data showing that COVID-19 trends are moving in a favorable direction. Phase 2 is likely to include some expanded operations for restaurants with limitations and safeguards. One area where Buncombe County will need to continue to consider specific limits on reopening is for leisure tourism. Due to the popularity of Asheville as a tourist destination and the fact that many areas of the country, including neighboring states, have extensive spread of COVID-19 transmissions, we will need to take a careful and gradual approach to inviting significant numbers of people from outside the region and state into our county. The current prohibition on leisure tourism will continue during Phase 1 in Buncombe County, but is expected to be incrementally relaxed in the subsequent phases. We hope to have a more detailed plan that can be shared for resuming tourist-related activities in the near future. I want to reiterate my thanks to all the people, organizations, and businesses in Buncombe County that have helped our community stay safe. It has saved lives. If we continue to work together, we will be able to bring our community back in a careful and responsible way. The county also appreciates the cooperation of all the municipalities in Buncombe County in this effort. The Mayor of Asheville, Esther Manheimer, is with us today and would like to make a few remarks.
Good afternoon. Today, the City of Asheville is joining with the county in aligning our Stay Safe, Stay Home order with Governor Cooper's extension to May 8th. I know that so many of us would like to return to a sense of normalcy. Our daily routines, our families, and businesses have been so severely impacted by the COVID-19 pandemic. We have seen that social distancing and the shutdown have had positive health results and are working to slow the spread of COVID-19. We want to see those positive results continue and not go to waste. In response to this public health crisis, our community has come together in unprecedented and innovative ways. I have no doubt that this will continue as we move forward. City staff is working closely with Buncombe County health officials to follow the plan outlined by the governor as to how we can safely reopen. The city is participating in a series of virtual town halls led by the Chamber of Commerce and the county to hear directly from businesses about their concerns and perspectives. Hundreds have participated in discussions about reopening in this new normal. This includes industry groups like manufacturing, child care and adult care, the arts, restaurants, health care, retail, and lodging. I want to thank our chamber for stepping up and pulling our business community together to work proactively to figure out how we can reopen in this new normal. This input will help develop clear and consistent guidelines to keep employees and customers safe as we look toward reopening our economy. While we are planning for next steps, our number one priority remains keeping everyone in our community safe. I ask for your patience as we work through the next few weeks. Please continue to stay home, practice physical distancing, and follow public health guidelines. Thank you for pulling together as a community. We have made progress, and we will continue to do so.
All right, thank you, Mayor. I'm now going to sign the superseding declaration for the Buncombe County local state of emergency. And I'd like to invite Fletcher Cove to come up to talk in a little bit more detail about these revisions and other county planning efforts related to COVID-19.
Thank you, Chairman Newman, and good afternoon. I'm Fletcher Cove, Buncombe County Public Health Emergency Preparedness Director. Today, I'll be discussing the revision of the Buncombe County Stay Home, Stay Safe order that Chairman Newman just signed and what we know so far about Governor Cooper's plan for reopening the state in 3 phases. The intent of this new order is to more closely align Buncombe County policy with that of the state. So as we begin Governor Cooper's phased approach to loosening restrictions, we can move forward in lockstep and match the governor's phases and messaging. Going forward, we intend to follow the governor's lead to the best of our ability in reopening our communities. But we will always reserve the ability to add further restrictions in the best interest of the residents of Buncombe County. Our new order goes into effect tomorrow at 6 a.m. on Friday, May 1st. As we align our orders today, the biggest and most noticeable change is that we are relaxing our mass gathering restrictions to align with the governor's current limit of 10 people. This means that people can get together in groups of up to 10, but must still conform to physical distancing of 6 feet and must observe all other public health guidance regarding hygiene, sanitation, and the use of face coverings. This relaxation of restrictions does not allow for non-essential businesses to reopen. We are also again strongly recommending the use of cloth face coverings in public settings, particularly when physical distancing measures are difficult to maintain. We know that many people, possibly a majority of people who have COVID-19, may be transmitting the disease without ever showing any symptoms. This is why wearing a face covering is so important. When you wear a face covering, you are protecting others from yourself. And when others wear a face covering, they're protecting you from themselves. So this mitigation tactic works best when there's a whole community buying in. So we strongly encourage everyone to wear face coverings in a public setting. In the latest version of this order, we also took out some sections that have since been covered or addressed by one of Governor Cooper's executive orders. Namely, guidance for grocers and retail, which the governor covered in Executive Order number 131, and restrictions on long-term care settings. Areas where we remain more restrictive than the governor are that we are still restricting lodging providers from taking reservations for leisure travel. And funerals are still limited to 10 persons. Additionally, people coming to Buncombe County from outside the state must still quarantine in their place of residence for 14 days prior to entering the community. We also continue to restrict Governor Cooper's Clause 2.c.1 in Executive Order 121, so that is not applicable in Buncombe County. To be deemed an essential business, you must be explicitly defined through that Executive Order 121. Last week, Governor Cooper laid out a framework for reopening the state in 3 phases to get us to a new normal. The timeline of the governor's phased reopening will be determined by a combination of metrics and data trends. From the limited information we have, Phase 1 may include a limited opening of non-essential retail, continued use of face coverings, and gatherings limited to no more than 10 people. Phase 1 is scheduled to last for 2 to 3 weeks. Phase 2 will see the governor lifting his stay-at-home order and a limited opening of restaurants and other businesses, limited gatherings at houses of worship, entertainment venues, and other public places. Phase 2 is scheduled to last for 4 to 6 weeks. Phase 3 will see increased capacity for restaurants and other gathering places to operate, and will be our new normal for the foreseeable future. This means that according to the governor's current framework, if everything goes well, Phase 3 will be coming sometime at the end of June or early July. That's assuming that we meet all the criteria the governor has put in place in regards to metrics and data trends. So everyone should be in the mindset that reopening is not a problem for May. It's an ongoing solution that will be a gradual process through May, June, and July. As we receive specifics on reopening from the governor and the state COVID-19 task force, we will push that information to the community in an informative manner so that everyone can start their planning and preparation processes. Thank you.
And now we will hear an update from Dr. William Hathaway, Chief Medical Officer for Mission Health.
Thank you, Stacy. I greatly appreciate the opportunity to participate in this press conference today and to do so remotely in an effort to minimize the community spread of the disease. We're trying to restrict all of our own travel, and I hope that this is in one small way an example to the community of how important it is to do that. I want to give a special thanks to those who have spoken before me and all who have been an intimate part of our community's response to the COVID-19 crisis. It's been a privilege and an honor to work with the county, with Dr. Mullendore and her staff, with the commissioners, and especially with Chairman Newman, with the city council and Mayor Mannheimer, and all those who have been involved in this response. I would like to give a special thanks to the frontline folks who have been intimately involved in the care of the patients and battling on the front lines, exposing themselves specifically to the emergency medical staff who face great personal risk as they approach the epidemic, and to the frontline staff at all of our healthcare facilities, Mission Health included, the nurses, the environmental service workers, the pharmacists, the respiratory therapists who approach this work in truly a heroic fashion. It's been heartwarming to see this. I want to start out by emphasizing that we fully and 100% support the phased approach that has been reiterated here by those who have spoken and by Governor Cooper. While we have meaningfully flattened the curve, I think it is critically important to remember that we have not eliminated the virus. We still have yet to develop a vaccine, and had we not adhered to the stay home, stay safe guidance from Buncombe County and the state, we would be in a far different situation. And for this, I'm grateful to all the citizens in Buncombe County and the surrounding communities who have done their part in making great sacrifices, personal and professional, to keep our community safe. I want to specifically address the issue of resuming or trying to get back to a new normal with respect to the delivery of healthcare services in our community, and by this I mean the 18-county region. As you know, we have been holding off on what have been referred to as non-essential or non-COVID related care. And I think it's important to recognize why we chose to do that over a month ago. Specifically, at that time, we had an unknown wave of patients coming at us, and we were concerned about critical availability of resources, including tests and personal protective equipment. We were concerned about the possibility of not having enough beds, both acute care and critical care beds, to care for our patients. We did not want to have patients unnecessarily exposed to the illness, and we were really at a time where we had uncertainty about what was approaching us. And so in an effort to conserve those resources and be prepared for the unknown epidemic, we held off on performing a variety of services. Well, what we've learned so far, and Commissioner Newman commented on this, we've seen between 20 and 25 patients at Mission Hospital to date, which was far less than we had anticipated. Our elective volumes and other acute care volumes have declined considerably, and we have been running at a census in the neighborhood of 50 to 60% capacity. What this means is that we think we have, at this point in time, adequate resources to start to provide the care, the necessary care, that we had delayed for our patients in an effort to be prepared for the unknown epidemic. And so we will be expanding and ramping up, as it were, our delivery of imaging services and procedurally based services and office care over time in a phased approach, much as has been advocated for the phased reopening of our community. And these services will include performing a broader array of procedures specifically, both in our hospitals, our offices, and in our surgery center. With this, as you know, we have imposed a significant restriction on access for visitors to the hospital. And in the interest of being stewards of the community and not exposing people to unnecessary risk, we will continue to have what we refer to as level 3 restrictions in place for most of our patients at the hospital, with the exception that there'll be some minor variations for patients who will be receiving procedures. When those procedures are scheduled through your doctors and your doctor's offices, the details will be relayed to you. But I want to emphasize that while we think it's critically important to provide the care that was delayed, the necessary care that was delayed, in no way do we think we're, as to use the colloquialism, out of the woods on this one yet. I think it's important to reassure the community that hospitals are a very safe place to go. I had conversations with my colleagues at the Pardee UNC system, Dr. David Ellis, and at the Advent system with Park Ridge Hospital with Dr. Teresa Herbert this morning. And just as we are increasing our provision of care, so are they. And we want to all reassure the community that it is a safe place to go. We have means and methods to protect patients from being exposed while in the hospital. And it is far more dangerous to delay care than it is to come to the hospital to get needed services. And this not only applies to the services that we're going to resume, but it applies perhaps even more importantly to emergency services. One of the most surprising things that I have seen in the course of this crisis has been a significant and frankly unexplained decline in our overall emergency care volumes, specifically as it relates to some of the most acute care that we provide. By that I mean heart attacks and strokes as examples. Across the state, patients coming in for acute heart attack care has dropped in the nature of 30 to 40%. And we are gravely concerned that patients are avoiding and delaying potentially life-threatening care in order to what they believe is avoid an exposure to COVID-19. I can emphatically and without hesitation state that if you are having acute care issues, be they related to your cardiac system, neurovascular system, heart attacks or strokes, breathing, that it is far more important for you to come to the hospital to get that emergency care than to delay it. And then in closing, I'd like to just comment on one issue that came up in the press recently. It's regarding the treatment of COVID-19, and I think many are aware that there was breaking news yesterday about the use of the drug remdesivir. Remdesivir is a medication administered to patients with COVID-19. It has been shown in a reasonably and well-conducted trial to decrease the duration of symptoms for patients with COVID-19 from an average of 15 days down to 11 days. And there is a trend and a tendency for this to maybe even have a benefit in saving lives. And we are very encouraged by this. We will have availability of this at Mission as needed for patients who qualify for its administration. But I want to emphasize that while this is the first treatment that we've seen that has proven in a clinical trial to have a benefit, it is by no means a panacea or a cure or a game changer in terms of how we deal with this illness. We are still critically dependent on the physical distancing that all have mentioned before, and I want to encourage patients, or encourage community members to continue to adhere to the guidelines as we phase out of the restrictions that have been put into place. Thank you.
In closing, we have a request from our nonprofit partner, United Way of Asheville and Buncombe County. There are needs in the community for cleaning supplies, non-perishable pantry food items, hand sanitizer, and there's also a need for individuals or businesses with the ability to provide supplies or the ability to sew cloth masks. And if you have the ability to provide these items or provide this service, please visit handsonasheville.org and click on the COVID-19 page. And once you're there, click on the I'll Give In-Kind Donations button. We will be back with our next community update on Monday at 2:30 p.m. Thank you.